Most autism conversations leave out the people who need the most support, not on purpose, but the result is the same. What you're about to hear comes from data and from families whose experiences rarely make it into policy, research, or public narratives. When people hear the word autism, they usually picture a very specific version of it: someone verbal, someone independent, someone who fits into a story that feels familiar and comfortable. But that's only part of the spectrum, and it's not the part with the highest support needs. There's a group of autistic individuals who need constant, intensive support to get through daily life. And when they're missing from public conversations, they're also missing from service planning, policy decisions, and research priorities. This focuses on that reality. It looks at how common profound autism actually is, and just as importantly, what families experience day to day. What shows up over and over again is stigma, not awkward moments, but real exclusion from communities, healthcare, and basic supports. If we want honest conversations about autism, we have to talk about the people who don't have the option to speak for themselves and the families who are doing that work every single day. So let's be clear about what this actually means. Profound autism refers to autistic individuals who, after around age 8, have very limited or no functional spoken language, a significant intellectual disability, or both. That age matters because early development can change quickly, but after that point, language and cognitive abilities tend to stabilize. This isn't a value judgment, it's a way of describing support needs. Many people in this group need help with daily living, supervision for safety, and consistent caregiving across their entire lifespan. And because of communication barriers, many can't advocate for themselves in systems that expect you to explain, negotiate, or push back. That responsibility falls to caregivers. Without clear language like this, systems don't plan appropriately, services don't get built, families are left navigating crisis after crisis. Naming these needs isn't harmful, it's necessary. Stigma doesn't always look dramatic. Sometimes it's subtle, sometimes it's constant. There's felt stigma, those internal moments of shame or embarrassment families describe when they feel judged for behaviors they can't control. Then there's enacted stigma, which is more visible, being stared at, excluded, asked to leave public places, or denied access to services. And then there's courtesy stigma, when the judgment extends to parents, siblings, and caregivers simply by association. Families of individuals with profound autism experience all of this, often amplified by behaviors that are misunderstood: vocalizations, aggression, self injury, or repetitive movements. These aren't seen as disability related, they're seen as disruption. Over time, that leads to isolation. Families stop going places, invitations dry up, communities quietly close their doors. Stigma isn't just about hurt feelings, it reshapes daily life, limits access, and compounds stress year after year. And here's why this matters beyond social discomfort. Stigma doesn't just affect how people are treated in public, it quietly determines who gets services, who gets believed, and who gets pushed out of systems entirely. To understand how widespread profound autism is, researchers looked across 6 different groups: 3 in the United States and 3 in Western Europe, spanning several decades, others in the 2000s, and one as recently as 2010s. Each used standardized assessments to look at language and cognitive functioning in individuals age 8 and older. What's important here is the scope. This isn't one clinic or one region, it's multiple populations, different countries, and different points in time. That makes these findings harder to dismiss. When patterns show up across settings like this, they tell us something about how autism is identified, support needs are distributed. And what starts to emerge is that profound autism isn't rare, it's a significant part of the autism population, even if it's often missing from the conversation. Here's where assumptions start to fall apart. Across these samples, the percentage of autistic individuals meeting the criteria for profound autism ranged from about 11% to nearly 60%. The highest rates showed up in cohorts identified in the 1990s. The most recent sample showed the lowest rate. That doesn't mean profound autism disappeared, it means diagnostic practices changed. Over time, clinicians got better at identifying autistic individuals with milder presentations, especially those who are verbal and cognitively typical. So, as overall autism diagnosis increased, the proportion of people with The highest support needs got smaller by comparison, but not smaller in absolute terms. This matters because systems often plan based on proportions, not real world demand. And that means the people who need the most support are often competing for resources in systems that weren't built with them in mind. When researchers looked closer, the patterns weren't simple. Some samples showed higher rates of profound autism among females. Others showed higher rates among males. In some groups, the rates were nearly equal. That reflects shifting diagnostic practices, especially for girls and women. The same complexity shows up with race and ethnicity. Several samples, higher rates appeared among racial and ethnic minority groups. In others, they didn't, and many samples simply didn't include enough diversity to draw strong conclusions. What we do know is that children of color are more likely to experience delayed autism diagnoses and more likely to be labeled with intellectual disability and before autism. So, prevalence isn't just about biology, it's about access, bias, and how systems respond to difference. So, if the numbers change depending on who's being diagnosed, when they're diagnosed, and how systems respond, the next question is unavoidable. What does that mean for the families living this every day? When caregivers talk about stigma, it's not abstract. They describe people filming their child during a meltdown, being told they aren't controlling their child, being stared at, whispered about, or excluded outright. One caregiver put it plainly: society talks about autism, but not the kind their child has. Public narratives tend to center independence, talent, or success stories. That leaves families of individuals with profound autism feeling erased. Their reality doesn't match expectations, so it gets dismissed. And this isn't rare. In these interviews, 85% of caregivers reported experiencing stigma, and that's not an exception, that's the norm. When behaviors aren't recognized as part of autism, families are forced to explain themselves or they retreat from public life altogether. And still, families keep showing up. Many caregivers talked about building routines, returning to the same places, engaging with the same people, creating familiarity over time. Slowly, reactions shift, judgment softens, communities learn. Some families described attending the same community spaces for decades until recognition replaced suspicion, not because stigma vanished, but because exposure changed understanding. Adults with profound autism benefit from consistent environments and familiar peers. Community inclusion isn't about access, it's about continuity. COVID disrupted many of these fragile systems, and for families, they've never fully returned. Rebuilding has been slow, uneven, and largely unsupported. This is where systems break down. Families describe years long housing waitlists, group homes that choose who they accept, and routinely turn away people with higher needs. Medical providers who dismiss symptoms as just autism instead of investigating pain or illness. Staffing shortages make everything harder. High turnover erodes trust. Respite becomes unsafe or impossible. Parents age without a plan for what happens next. Advocacy becomes constant, exhausting, and necessary just to maintain stability, not to improve quality of life. Many families aren't asking for perfection, they're asking for something that works. So, what needs to change? We need better data, especially from communities that are underrepresented. We need healthcare providers trained to work with individuals who have profound autism. We need serious investment in staffing, housing, and lifelong supports. And we need to stop designing policies with the people who are carrying the greatest burden of care. Most importantly, caregiver voices must be centered not instead of autistic self advocates, but alongside them, because many individuals with profound autism cannot speak for themselves. This group represents a significant portion of the autism population, and their needs don't disappear with age. If systems are going to work, they have to be built for the people who need them the most.